Okay, so as we are aware about the basics of the systematic review, our next step is to apply the step-by-step process of systematic review with respect to a specific research question. In the previous lecture, we have learned about the research question. Now, we are going to formulate the research question with respect to a specific PICO framework. We have selected a research question where post-stroke population is selected to compare the efficacy of virtual reality balance training in comparison to standard rehabilitation on the balance outcomes assessed through Bergen balance scale. So, according to these PICO elements, our research question would be: what is the efficacy of virtual reality balance training in comparison to standard rehabilitation on the balance of post-stroke patients? So, as a research question is formulated, our next step is to determine the eligibility criteria of the review. Eligibility criteria is basically the standard for determining the inclusion and exclusion of studies with respect to their specific parameters within the review. So, for the eligibility criteria, we need to define the characteristics of the population in terms of age, gender, and stage of the condition. We also need to look into the intervention and comparison groups with respect to the type of interventions used. We need to look for the primary and secondary outcomes, if any. We also need to find out the studies we are going to add into our review with the reasons to justify its inclusion. We also need to justify the language of the included literature along with the publication range of the included literature. These components are necessary to justify for ensuring the clarity and transparency within the research process. So, in the next slide, I have selected the eligibility criteria for the review we are going to carry with respect to the research topics. So, according to our review, the participants will be those suffering from stroke between the age group of 45 to 65 years. Okay, so this age group was selected because stroke patients most commonly lie within this age group due to multiple comorbid conditions, either diabetes, hypertension, and other metabolic conditions, which interferes with the blood supply and may and results in various clots and plaques and etc. Okay, so 45 and 65 year is basically the ideal age we from where we get the stroke population. Okay, so the exclusion criteria would be the patients having not having stroke as their primary health concern. For instance, patients having multiple comorbidities. In such cases, if we allow the inclusion of patients having multiple comorbidities, then it would affect the efficacy of a result because there are multiple conditions and we cannot differentiate either what is the effect of intervention, what is the effect of sole intervention on the sole outcomes of the stroke patients. Okay, so as our intervention is virtual reality balance out our balance training, so we will be looking for the studies having virtual reality as their primary outcome. Okay, and exclusion would be balance training not based on virtual reality, as we know that there are several standard procedures for doing the balance training, so we will only include the balance training that is based upon virtual reality. Okay, comparison would be simply to any standard care group or control group outcome. Okay, so as we have taken the variable of balance, so we need to take a valid and reliable outcome measurement tool which is highly specific for assessing the outcomes of balance. See, so we have found BBS, Bergen balance scale, which is highly valid and reliable for assessing both the dynamic and static components of balance. So we will be taking or looking into the studies which are comparing virtual reality balance training in comparison to standard rehabilitation on the BBS, means Bergen balance scale of stroke patients, and exclusion will be the studies not having BBS at their outcome. Okay, so in terms of the study design, we will be including, okay, as we have discussed previously, there are multiple type of studies: primary studies, secondary studies, experimental studies, non-experimental studies, and so on. There are a variety of studies, but we need to justify the inclusion of our studies. We will be taking RCTs. Why RCTs only? Because RCTs are the randomized control trial. Randomized control trial whose specification is randomization, which means participants are randomly distributed. It means that both the group participants in both the groups have the equal opportunity to be assigned to either an interventional group or control group. So we are taking RCT as the basic study design because it has the less chances of bias and increased chances of credibility. Further, this is the gold standard study which compares the variables and outcomes. Okay, for determining the best possible outcomes for the study. Okay, so we are taking only out RCTs and excluding all other studies like observational studies, case control studies, cohort studies, case reports, case series, and surveys. Okay, and for the time frame, we are choosing the studies between 2012 to 2024. This time period is chosen because this is the time period of the last 12 years. We need to define either what the virtual reality has been grown or evolved over the period of last 12 years. So we are taking specifically the last 12 years so we can check either what is the difference between the virtual reality balance training in the previous years like from 2012, 2014, 2015, or what is the difference in the recent years. Okay, and we will be excluding the studies which are below 2012. Okay, and English language will be our restriction because of the targeted population, as English is the basic language and standard language used multiple across the country. So we are taking English as the basic language and excluding the all other languages that could create a reason of bias. Okay, and we are not taking any translated language translated studies which are directly translated from any other language to English because it could create the chances of error bias in the studies. So this is the eligibility criteria for our review. In the next lecture, we will be defining the search strategy based on this eligibility criteria, and then we will be finding the studies which are based upon this eligibility criteria, and so on and so forth.